We now move to our next fireside chat, affordable healthcare at scale, insurance, innovation, and access. To moderate this conversation, may I first invite Ms. Priya Singh, anchor and producer, Times Network Digital, to kindly join me here on this stage. May I request all the ones who are in the hall, if you can please put your hands together for Ms. Priya. And now, ladies and gentlemen, it is my pleasure to welcome our distinguished speaker, Mr. Sanjay Kumar Sharma, CEO, Biodeal Pharmaceuticals. As a leader in the pharmaceutical industry, Mr. Sharma brings valuable perspectives on healthcare accessibility, innovation, affordability, and the evolving healthcare landscape in India. Ladies and gentlemen, please join me in welcoming Mr. Sanjay Kumar Sharma with a warm round of applause. We are delighted to have you, sir, here. And Priya, the stage is all yours.
Thank you. Thank you so much. And once again, welcome here. Today, we all are here and we are talking about how to take care of our health. And we covered so many topics. But now, we will talk about affordable healthcare, which is very much important.
Absolutely.
So Mr. Sanjay Kumar Sharma is with us. So I would like to ask to you the first question, that what is the biggest challenge in making healthcare affordable in India?
Okay. See, the biggest challenge, what is coming, is we are not detecting the illness at a very early stage. So, early prevention and detection of anything which happened, it reduces the burden to the end patient. What I want to say, if we diagnose earlier, the insurance pay, the money which is going to paid by from the pocket of the patient is going to be substantially reduced. That is the one thing. Another is a technology.
Right.
See, if I will say with the 3 decades of my experience, if our manufacturing facilities are highly equipped, where in the span of 8 hours, if our manufacturing facilities deliver something and substantial, it will reduce again the cost of manufacturing medicines. So where with the age-old manufacturing units, we was manufacturing the medicine of a different standard. Now with the technology, it has been revived, revamped. Now the same medicine is costing and it is a patient-friendly and easy to, end user. And if the earlier doctors was using thrice a day or every 6 hourly medicine, now once a day is sufficient. So that way that pays the role of a patient where he is spending a less.
You talk about technology also. So how technology help reduce healthcare cost and improve access to everyone?
So I will tell you the use of digitalization, AI, and if it will reach to the end of the patient and they are aware about the well-being to treat, what are the things which we can take as a precautionary, don't lead to the last stage of diabetes and all. So it will always help to a public, to a end customer to get a benefit from that. So early prevention is a must, and technology helps, media helps, awareness helps, well-being helps.
So we are talking about technology, that how it will help to reduce the healthcare cost also. So what one step can make the biggest difference in achieving affordable for all of us? What do you think so? As you talk about early diagnosis.
I will tell you, it will educate the people, educate the end customer, give them a proper information. So prevention is the cure.
And how can the pharmaceuticals industry help more people access quality treatment at lower cost?
That is again, I am telling the
You are
collaborations.
sticking to one point only. That
No,
only.
that is what I am telling you. I will tell you there is a,
Well, this is the only thing. If that particular disease or whatever the people are going through, the person is going through, it will detect on time. Then only they can save their life, their money also as well.
yeah.
If you agree on this.
No, I am telling you, if they are very particular with the innovation, with the technology, it definitely going to deep drive.
Right.
Because they will get the output as a pharma industry, what as a person, what we was providing earlier, the molecules, the which gives the end results. That is totally different as of now. Now there is a better molecules, the better facilities are there, and the better treatment is there.
So if you could introduce one major reform to make healthcare affordable, we are talking about it, so for everyone, what would it be?
Education.
Education.
Yeah. Too well aware about the education to the end, and there is a different roles of the media, manufacturing facilities, doctors, consultants. Everyone has to play the role.
We are talking about innovation and access also affordable health care at scale. As India aims to become a global healthcare powerhouse, what role can collaboration between pharma companies, insurers, healthcare providers, and policymakers play in improving access to care?
Again, see, I am telling, if we are having a
I got it.
US
Uh-huh.
is manufacturing a latest example of semaglutide, the obesity. We are hearing from last 2 hours that what obesity can cause, how many different, illness can be created with that. And if we are launching the semaglutide as of such, which can reduce a particular risk of different ailments, you will feel like that the other way around, the end patient is going to get friendly and it is help him.
Anything else which you really want to share from here, which is very important, and we should talk about that?
So,
You want to share anything?
So I want to share is that we have to trust on our, doctors, medical fraternity, listen to them. If they diagnose something and educate the people, the patients, we have to follow the recommendations from that consultants. So that is what I want to say.
Anything else? Because pharmaceutical industry is doing really well, and they are welcoming the technology, the AI. How it helps?
So again, the AI plays an important role in the healthcare. But AI is based on the data which has been feeded and from the back end. But it helps and reduce the time and helps
Is
a
it
consultant
giving
also.
accurate, what we can say, if we are measure it on a scale, what are the points which you want to put here?
So again, on the basis of the AI, we had gone through the sessions and all recent sessions, and the accuracy in some of the cases from 1 to 10 scale is 9, because for diagnosing a single photograph and single diagnosis, a lakhs of photographs gone through with that AI has to be come up with that end result.
So what are the changes which is still required in that field?
Again, it is a digital, and the sacrosanct means it
lack
is a
of-
digital.
Right.
So the whatsoever we are feeding it, that has to be, the accuracy has to be there on the digital.
Okay.
So then the AI will work more promptly.
Okay.
Yeah.
So this is your suggestion
Yeah.
that how we have to work on this.
Yeah.
So thank you so much for your valuable time for coming here and
Thank you.
joining us. Thank you so much.
Thank you very much.
with our next session, which is cancer remains one of the most significant healthcare challenges facing the world today. And India is no exception, with rising incidence rates, increasing healthcare demands, and the need for timely diagnosis and treatment. Addressing this cancer burden requires a comprehensive approach, one that combines prevention, early detection, advanced treatment, public awareness, policy support, and equitable access to care. While medical science continues to make remarkable strides in cancer treatment, the larger challenges lies in ensuring that these advances translate into better outcomes for patients across every region and community. To discuss the path forward and explore actionable solutions, we now move to our next fireside chat, steps to follow towards addressing the cancer crisis in India. We have on the stage with us our moderator, Priya Singh. And now it is my distinct honor to welcome a globally respected oncologist, researcher, educator, and health care leader. Please welcome Dr. Noori Dattatredu, Professor and Director, Cancer Center, New York, Presbyterian Hospital of Cornell University, and the advisor of governments of Andhra Pradesh and Telangana on cancer care. Okay. So, ladies and gentlemen, with decades of experience at the forefront of cancer treatment and policy, Dr. Noori has played a pivotal role in advancing cancer care, promoting innovation, and improving access to quality treatment for patients around the world. Throughout the summit, we have explored some of the most critical themes defining healthcare today, from innovation and artificial intelligence to preventive care, women's health, cancer care, accessibility, affordability, and the future of medical excellence. More importantly, we have heard from the leaders, policymakers, clinicians, researchers, entrepreneurs, and change makers who are driving this transformation every single day. The discussions we have had today remind us that the future of healthcare cannot be built in silos. It requires collaboration, innovation, compassion, and a collective vision to create systems that are more accessible, equitable, resilient, and patient-centric. On behalf of Times Network, I would like to extend our sincere gratitude to to all our distinguished dignitaries, speakers, panelists, moderators, award recipients, partners, delegates, and members of the media for making this summit a resounding success. A special thanks to all our event partners for their valuable support. The Times Network India Health Summit's 2026 South Edition was powered by Tamashi. Our associate partners were Giglu and Real God. Our real estate partners was Sumadhura. Our knowledge partner was Voice of Healthcare. And our automobile partner was BMW Krishna Automobile. Thank you for your partnership and contribution to this platform. I would also like to acknowledge and thank the entire Times Network team, our production, Mr. Krishna, and event partners, the venue team, the technical crew, hospitality teams, and everyone working tirelessly behind the scenes whose dedication made today's event possible. Until we meet again, stay inspired, stay connected, and continue making a difference. Thank you. This is your host, Madhvi Reddy. Have a wonderful evening and a safe journey home. Jai Hind.